everybody. Welcome to Pick Dr. Osborne's Brain. We got a great live Q&A for you. So if you've got nutrition questions you need to get answered, go ahead and start typing those into the chat or the comment box to the left or below the video, and I'll do my best to get as many of those answered as possible. Now, if you missed earlier this week's show, we talked a lot about how the medical system is, in a sense, failing under the weight of its own recommendations. If you've got commentary about that, we'd love to hear that as well. And if you missed the show, it's a great drive back through the history of medical advice and health advice, nutrition advice that's been given that has actually been very, very wrong and proven to be wrong at this point. So you might want to go back and check that out as well. Okay, well, let's dive into your questions. Donna's asking, do you have a program or page that tells what supplements can or cannot be taken together? No, we don't have like an overall program that dives into that, Donna. There are very few contraindications when it comes to what supplements can be taken together. The vast majority of them can be taken together without any kind of major contraindication. It's always best, though, to work with your either nutritionist or healthcare provider or doctor, especially if you're taking certain medications, because there can be drug-nutrient interactions with some things. Now, generally speaking, most nutrients are very safe to take with drugs, but there are exceptions to that rule. And of course, you'd want to know what that was if you're trying to take something particularly and you're also taking medicines. Let's see here. A lot of comments. If someone's on a healthy plant-based diet and has 30 milligrams of added sugar a day, is that still too much? I currently have one candy bar a day. So, okay, let's just talk real for a minute, Amanda. If you're eating a candy bar every day, you're crushing your health. You know, that candy bar, you know, the sugar in it most likely is genetically modified corn syrup. There's probably soy in it. There are probably a number of other emulsifiers and added compounds and chemicals that are just not good for you. So no amount of candy bars eaten on a daily basis is going to ever be healthy. And it's just not something I would encourage you to do. And a plant-based diet is not going to save you from the damage that candy bar is going to do to your health in the long run. Now, if you're talking about 30 milligrams of added sugar because you had a piece of fruit and you're talking about the sugar in the fruit, that's a different story altogether. But if you're talking about processed, GMO'd, glyphosate-loaded candy bars, that's a bad idea. Formula makers encouraging social media influencers to promote baby formula. Help me understand, is this happening currently or in the past? Both. It's an ongoing ordeal. Let's see. Let's see, my 7-year-old has a lump. I put castor oil on it for a while and it got it to shrink and go into 2 lumps, but once I stopped, it just went back to normal. Is there anything you suggest I do? Well, I mean, that's Holly, hard to know. I mean, castor oil is not a cure-all. The castor oil can be effective for a lot of things and be helpful for a lot of things, but you know, again, what kind of lump is it and why did it grow in the first place? If you're thinking that it was caused by an injection, you know, don't know if that is the case or not. But again, I'd follow up with probably a good functional doc. You know, if your other doctor's not willing to have a conversation about why it's there, follow up with another one that would be. You know, you get to choose. It's a great thing. You know, especially if you're in the U.S., you get to choose your doctor. And a lot of people look at their doctors as, I don't know, a lot of people look at doctors as, if the doctor says it, it must be true, it must be right. But don't ever forget that when you're talking to your doctor, you're actually getting an opinion. It's an opinion that's being rendered and not a fact that's being rendered. And we can have all the trust the science rhetoric in the world that we want to, but at the end of the day, the doctor is still giving a subjective opinion based on their experience and based on their education. And sometimes those opinions are extremely wrong, and sometimes those opinions are accurate and right. And so the good news is you have the choice to pick the doctor. And if you don't like the doctor and if you don't like the opinion, you can get a second and a third and a fourth one. You just have to be diligent. Let's see here. So, can you use castor oil with dermatitis or pediformis? Doing pretty well with no grain, no pain, but DH is still in my face and scalp. Confused with castor oil. Can you take orally? I would only use it on the skin. I mean, you can apply it to the skin, although I wouldn't apply it directly to open wounds on the skin. Whether or not it'll help with dermatitis or pediformis, it might exert an anti-inflammatory effect in that regard, but if you're still having DH, you really need to dial in and look at your diet a lot more carefully and make sure you're not getting any kind of cross-contamination. And I would even go so far as to say quit eating all processed food, because there's a lot of evidence coming out now on certain elements in processed food also being a trigger for celiac and celiac-related disorders. You remember there are a lot of things that can cause a celiac mimicking effect. Yeast overgrowth can cause it, and so you may be struggling with intestinal yeast overgrowth. Antibiotics can contribute to it. Certain blood pressure medications, especially the angiotensin receptor blocker family of blood pressure medicines, steroids, and non-steroidal anti-inflammatory medications. I mean, there are a number of things that can contribute to that same type of problem, and so you need to look at all those things together to make sure that those are not part of your issue. Because if they are, castor oil won't do anything. Castor oil is not going to fix the problem. Something else is triggering, and you got to figure out what that is. Linda's asking if villous atrophy, does villous atrophy ever heal? It should. Now, what can sometimes happen, Linda, is you get a severe enough damage in the lining that instead of a full, just like if you got a severe enough cut on your skin, it would scar. You would have scar tissue formation. And so the skin where the scar forms won't grow hair, won't secrete oil, won't sweat. Scars are non-functional tissue. But, and this can happen in the intestines too. You can get a deep enough damage or long enough inflammatory damage that you could actually probably end up with some micro scarring of the intestinal villi or lining. Now, that being said, it still will heal. You will still have a healing effect or an impact. It's just that you might heal where some aspects of your intestinal lining are less functional than others, but definitely can heal. And what we've seen in research studies in celiac patients is, 2.5 years, 5 years out, many of these patients that continue to do things like eat rice and corn and other grains that are being labeled gluten-free continue to have villous atrophy and villous damage. So if you don't know about No Grain, No Pain, not again the name of the book, No Grain, No Pain, check it out, read it. You'll learn a lot more about why many celiacs fail to recover their villi, even being on a traditional gluten-free diet. It's because there are other forms of gluten in these other grains that can also create villous atrophy, and you just want to be aware of that so that if that's something you're struggling with, you can overcome it. What do you think about the detox patches that you put under your feet? I'm not 100% sure what you're talking about, Lynn. I mean, I know there's a number of products and patches and other things that that people claim are helpful or that work, but if you can't give me an exact ingredient that's in the patch, it's hard for me to really give you a comment that's intelligent. I purchased Ultra Nutrients, but was surprised it contains such a low amount of vitamin D. What was the reasoning? The reasoning is that there are many people that struggle with chronic kidney issues and can't handle larger amounts of vitamin D. And so we don't put mega doses of vitamin D in the multivitamin. The other reason is because vitamin D is best in the form, it's best given in basically in an emulsified form or in a fat soluble form. And that's why you also see at Gluten Free Society, we have something called liquid D3 and gluten-free D3. Both of them are emulsified. so that when you take them, you get close to 100% absorption. But when you put vitamin D in an encapsulation, as you know, as what a multivitamin is, you get a reduction in the capacity to absorb fat-soluble vitamins. So you'll notice in that formulation, there are no mega doses of the fat-soluble vitamins at all. And that's just because delivery matters, and how they are put in is going to matter in terms of absorption. And again, many people coming away from gluten already have a problem with fat malabsorption. So if you're really looking to up your D, I recommend using either liquid D3 or gluten-free D3 as options, because both of those are emulsified products and you'll get close to 100% absorption out of them. What oil can I use to cook a steak? I don't barbecue. I don't like avocado oil. You don't necessarily need oil to cook a steak. You just put it in the pan. If it's a good steak, it's going to have some marbling in it. So the fat from the steak is going to liquidify into the pan, and so you'll have a good surface in that pan. If you don't barbecue, I don't know why you wouldn't want to barbecue a good steak. But then I'm from Texas, so we love barbecue ribeye. So, but as far as other oils, you could use coconut oil, but in my opinion, you'd ruin the steak. You could use palm oil, but in my opinion, you'd ruin the steak. Some people would say use butter. If you're not dairy allergic or sensitive, if you're using an A2 grass-fed butter, that might be an option to, again, give your pan a little lubrication. But I would just use the natural oil from the steak itself. You might also, again, consider other animal fats like duck fat. You can buy commercially duck fat, and you can even render your own fat. If you ever cook ground beef, you can take that oil off that ground beef, put it in a mason jar, and then you can use that fat to make other things. You can use it to cook with, and so all those are potential options for you. Hi, Dr. Osborne. What test should I request my PCP to run to measure my current levels of inflammation? So there's several that are real common that most doctors won't give you a hard time about. One of them is a test called homocysteine. One of them is called HS. The HS stands for high sensitivity, and then CRP, high sensitivity CRP, or high sensitivity C-reactive protein. There's another test called ESR, erythrocyte sedimentation rate. So those are three very common tests most doctors will run that help to detect systemic inflammation. Now, there's a lot of other ones, but we'll get into the realm of specialties and specialization, and that's when doctors really start to give people a hard time. But I would start with those three. Hi, Dr. O. I heard you say the other day about kale being very toxic, and if you were getting large amounts of it, could be causing trouble. I use about 1/4 cup grilled up with some spinach and red cabbage and bacon grease with my eggs. Could that amount possibly cause some buildup issues of toxicity? I was thinking maybe you were just talking to the people using a ton of it every day and juicing. So probably 1/4 cup a day. Could be. I mean, there are a couple of different things that can be problematic for some with kale. One would be that kale, even organic kale, can be high in thallium. And thallium is a toxic metal that can, for many people can make them struggle and have problems. One of the other problems or issues with kale is the oxalate content. Oxalates, some people have a high oxalate level already, and so adding foods that are high in oxalate can increase the risk of oxalate deposition in their tissues. And a classic example of oxalate toxicity would be somebody who has frequent kidney stone formation of the oxalate variety. So there's more than one kind of kidney stone, but one of the most common is called a calcium oxalate stone. And so again, kale is a high oxalate food, and that could contribute to that, again, if you're a kidney stone former. But oxalates can also deposit in other tissues. So some people that have severe arthritis or muscle aches, muscle pains, those can be, not all, but can be signs of oxalate toxicity. And so one simple way to know whether or not, adding that kale to your daily diet may or may not influence is to ask your doctor to run what's called a 24-hour oxalate test on you and just try to get an idea, or at least some type of objective measurement as to whether or not your oxalate values are high to begin with. Because if they are high to begin with, you might consider going on a low oxalate diet or an oxalate-free diet. Let's see, Angel says, hi doc, 7 years ago I had an endoscopy which shows my villi were flat but was told I don't have celiac. Is it possible to have flat villi and not be celiac? I can't eat wheat, corn, oats, and all the pseudograins without horrible adverse symptoms. My doctor tells me avoid gluten. So, I mean, Angel, maybe it's helpful if we describe or explain the criteria for diagnosing celiac disease. So there's a set of medical criteria that are generally used to diagnose celiac disease, and one of those criteria is a positive villi atrophy or positive villous atrophy on a scope. So you've met one criteria. One of the other criteria is what's called positive serology, which is where they'll run tests like anti-tissue transglutaminase or anti-endomysial antibodies, or another one's called an anti-gliadin antibody. And so if you test positive for those types of antibodies and you have villous atrophy, then generally your GI doctor or whoever you're working with is going to give you a diagnosis of celiac disease. So it's mysterious to me why they wouldn't have done that, given you that clinical diagnosis, just by nature that you react to grain and can't eat grain without severe adverse symptoms, and you have villous atrophy. Now, they may have done blood tests and they were negative, and that's why they didn't give you the positive confirmation of the diagnosis, but sometimes a diagnosis is made clinically, meaning that you can have negative serology and the doctor could still give you the diagnosis based on the fact that you have obvious reactions and you are positive for villous atrophy. So again, I don't want to put words in your doctor's mouth. I don't know what their thought processes were, and I don't know what other things they know that I don't have access to information about you about. But it is also possible to have villous atrophy and not be celiac. What are some things that can cause villous atrophy in the absence of celiac disease? Well, one is parasite infection. There are certain types of parasites that can also cause villous atrophy. Certain bacterial infections or viral infections can contribute to villous atrophy. Medications like steroids and non-steroidal anti-inflammatories can contribute to villous atrophy. There's another medicine called ARBs I've mentioned earlier, angiotensin receptor blockers. These are drugs like olmesartan and telmisartan. This class of medication has been shown to cause villous atrophy. They're about, the last count, I think like 137 or so case studies published in medical literature on that class of medications being a cause of villous atrophy. So you've got other things that can cause villous atrophy, which is why maybe your doctor didn't diagnose you with celiac disease, because if you had villous atrophy but not positive serology, they may have thought, well, maybe one of those other things is causing your villous atrophy. Don't know. Again, I can't comment as to what their thought process was, but you can definitely have villous atrophy without being celiac, and but you can also have villous atrophy that can be caused by multiple things and still be celiac, right? So you could have, for example, a parasite infection and you could be celiac, and both of those things could cause villous atrophy. So, we can get into the weeds on the nuance of all the different variable presentations that someone might have, but I think I've answered your question. So Suzanne says, I have friends doing liver flush with coffee enemas. They have stones, big and small ones coming out. I have not done one as of yet. What's your input? What's my input on what? Whether or not a person should do a coffee enema or why the stones are coming out. I would say you can do a coffee enema, but you shouldn't rely on a coffee enema to be healthy. A coffee enema is a tool, like many things. It's a tool that can help stimulate gallbladder contractions, and it can help push toxins out. But the bigger concern is if a person needs to do coffee enemas to detox their liver, then what are they doing to their liver year round that requires it needs to detox all the time? That's my opinion on it. I'm not opposed to somebody doing a coffee enema. I'm just opposed to somebody relying on a coffee enema to clean their liver when they have horrible diet choices and horrible behaviors that affect their liver negatively, and then they rely on a flush or or an enema to offset the other damage that they're doing. And if they would just stop doing the other things that were causing the damage, then the enema wouldn't even be required. What's the fastest way to kill tapeworms? Currently using prosequinol, ivermectin, diatomaceous earth, activated charcoal, castor oil. They are dying. I see them, but can I flush them out? Well, you are. It sounds like it. Those are all, those are all great things that you're doing. You could also add, if you wanted to add more, you could add some wormwood. Is a very good and effective natural remedy as well. You could also look at doing like a vitamin C flush if you want to really flush your bowels out. And the way that's done, Darla, is 2 teaspoons of vitamin C every 15 minutes until your bowels start flushing. So it's 2 teaspoons of, if you're using our Detox C, that's 6 grams of vitamin C every 15 minutes. And this is done on an empty stomach first thing in the morning. You don't want to try to do a flush like this after a big meal, because you're just going to push all that food right out of you and it's not going to be comfortable. So definitely want to do a flush like that on an empty stomach in the morning. Hi, Dr. Osborne. Would you recommend to take high doses of niacin for knee osteoarthritis? And if so, what doses and for how long? Not really. I mean, I would, if you've got knee osteoarthritis, niacin's probably not to say that it couldn't be playing a role, but it's not what comes to my mind first and foremost when somebody's struggling with osteoarthritis. What does come to mind for me is lack of motion and movement, or obesity. So generally, if it's the knee, a lot of people develop arthritis on the knee because they're overweight and they're putting excessive pressure on those knees over time, and that's going to degrade the joint faster. One of the other causes of knee osteoarthritis is chronic sitting. So if you're at a desk, 8 hours a day, and you're not stretching or taking time to get up and walk around and kind of get that motion back into your leg, into your knee, and the cartilage will degrade more aggressively and quicker. So I would look at motion as would be my first and foremost, would be the thing that I would say anyone with knee osteoarthritis needs to first reestablish good joint range of motion and good movement in that joint, because a lot of times that's the solution, and you don't necessarily need high doses of other nutrients. Now, there are some other nutrients that definitely can contribute to osteoarthritis and increased pain. And the two that come kind of probably at the top of that list, one of them would be boron, the mineral boron, and the other one would be omega-3 fatty acids. Those two would be what I would gravitate toward. And if you're looking at boron, somewhere around 6 to 10 milligrams a day, for a period of a few months to see if it's helpful at all. And if you're talking about omega-3s, I would recommend 2 grams to 3 grams a day, so 2 to 3 grams a day, for a period of several months to see if you get any kind of benefit out of that. And if you're looking for a high quality omega-3, you can check out our Ultra Omega. It's a highly concentrated version of omega-3, EPA, and DHA, so it's a nice equal blend of the two, along with enzymes that help you if you have a hard time digesting fat. There are enzymes in that formula that actually help you digest the omega-3 and absorb it properly. Will triglyceride oil and CoQ10 max raise one's triglyceride levels? No. What raises triglyceride levels in humans predominantly is not fat at all. High-fat diets don't raise triglyceride levels. Let me rephrase that. High healthy fat diets. Now, if you're eating a bunch of trans fat or saturated fat, that's not good. You will get triglyceride elevations. But for most people, what causes their elevation in triglycerides, Mary, is excessive carbohydrate consumption, because your body is super effective at taking excessive carbs, converting them into fat for storage. And that fat that it converts those carbs into is triglycerides. So if you want to really lower your triglycerides, you really got to look at your carbohydrate intake as a potential for why they're high. Does NAC contribute to kidney stone formation? No. NAC, N-acetylcysteine, no. It's not going to drive the formation of kidney stones. So Diana wants to know my thoughts on how the immune system might be affected long-term after a person has had a COVID infection, but not necessarily been vaccinated. So I mean, I wouldn't look at COVID as affecting your immune system long-term any more than any other cold or flu. I mean, it's a cold. That's what it is. And, I think at this point, we all see, you can get a cold, and colds don't feel good, and colds make people feel blah for a while, and there can be some consequences of that. But COVID is not more special than, say, other types of viruses in terms of giving you a cold, where it's going to long-term eradicate or destroy your immune system. I think where most people get a cold or a flu, and they continue to struggle after that, it's not because of any other reason, that there are other things going on in their life that could be potentially causing immunocompromisation. So, if you get a cold, your body should be able to naturally respond to that. You should be able to naturally overcome that. You shouldn't take, months and months and months for that to happen. And as far as your long-term immune system, again, it shouldn't really be impacting. Most people that I know that are suffering with long COVID, or that I've seen in my practice that have suffered from long COVID, those people have severe malnutrition coming into COVID. They also have a ton of other issues in their diet and in their behavior and their lifestyle. So when they got sick, it was just kind of the proverbial straw that broke the back. And so because they have all these other bad habits and behaviors, they're having a really hard time recovering. One of the other common issues I see in people who really have that long COVID issue is those people tend to be in mold. Meaning there's some type of mold overgrowth in their home, whether it's in their bathroom or whether they have an invasive, mold overgrowth because of an HVAC system problem or a leak in their house, because mold is highly, highly, highly immunosuppressive. So a lot of these people that continue to struggle, if those of you watching this that maybe you've been told you have long COVID and you have no idea why, and you eat well and you exercise and you've done all the right things, but you're still struggling, you really want to consider the potential possibility that you have a mold issue in your home. Can you talk about enzymes for your gut? I'm having issues, yellow stool, burping, pain in stomach area. I have to watch my fat intake. So that may be enzymes, but it also may not be enzymes. It might be bile. Okay, so you can use enzymes like lipase, which is an enzyme specific for fat. But if that's not really super helpful, then you need to look and consider something like an ox bile supplement. We have something called Lipogest, which I can put a link up for you if you'd like. And that is very helpful to support people's ability to digest, especially specifically fats. You might also, too, go back and watch. We did an entire crash course on enzymes with Dr. B, a good friend of mine here locally in Houston, and he's an enzyme researcher, and so you might check that show out too. Maybe we can put a link up to our enzyme show. What advice would you give to people who have Turner syndrome? I would tell them to go gluten-free. There's genetic linkages between Turner syndrome and gluten sensitivity. I've seen some cases of Turner syndrome who've responded extremely well to diet change, and so that would be, if I could just tell them one thing to do, it would be that. My toes have an inflammation strip across the front, half, can't get rid of it, no fungus on them. Too little or too much of something? Don't know. It's hard to say. You could have, maybe it's not fungus, maybe it's something else. There are other things that can impact the toes. You might also look at your shoes. Are they tight? Do your feet sweat a lot? Is there the potential for that dark and wet to allow for overgrowth of bacteria or the microorganisms that could also create an inflammatory process? Yeah, absolutely. You might also get them checked out by a good podiatrist or, a doctor who, who cares about root cause. So, there are a lot of things that you could do, but I would say you really kind of want to understand why it's there. And I would encourage you to visit with a doctor, maybe get a culture to see if there's anything they can get to grow out of it, because it may not be fungus, but it may be, again, it may be other microorganisms that are driving that process. Christine says, hi, Dr. Osborne, can you address the issue of oxalates in the diet causing all sorts of problems? We have, Christine. I'm going to put a link below for you to our oxalate crash course. And just so those of you who are also interested in oxalates, I have Sally Norton coming on as a guest here next month. And so we're going to do a deeper dive even beyond our crash course into oxalates as well. So stay tuned. I'm going to be going much deeper in that category. Robert says, diagnosed with non-fatty liver. I don't know what that means. You were diagnosed with non-fatty liver, so your liver's not fatty? Because that's not a diagnosis, that's just a normal liver. Or were you diagnosed with non-alcoholic fatty liver? Robert, I'm going to assume you mean non-alcoholic fatty liver, okay? Just for the sake of the question. Took 50 milligrams of zinc. Hours later, had a severe headache and nausea. Should I risk a lower dose? This was awful. I don't get headaches. Hard to say, Robert. I mean, if without knowing what was in your zinc product, was there something in your zinc product, maybe a filler, that you were reacting to potentially? Zinc is not one that generally tends to give headaches, just not in my experience. And I've seen thousands and thousands of people take, therapeutic doses of zinc. And headache would be the last thing on the list that I would suspect as being a problem with taking zinc. Now, is it possible that it was a zinc? Yeah, everybody is unique in that regard. So I wouldn't rule the zinc out completely, but I'd also look at the fillers in the product and maybe consider that is also a possibility. Beyond that, if it gave you that bad of a headache, I would probably stop it and follow up. If you had a doctor put you on zinc, I would maybe talk to that doctor too. Do you have experience with granuloma annulare and how to heal it? Thanks a lot of greetings from Switzerland. Love it when we are reaching that far out in the world. Yeah, I mean, it's, in my experiences, generally responds really well to no grain, no pain diet. Esther, if you haven't checked that out, I would encourage you to maybe potentially check that out first. Dr. Osborne, any news on getting your products to Europe and other countries overseas? No new news. Still trying to work out logistics. I have celiac. Diet has let me know starch of any kind produces mean acid reflux. No, more of a comment. Are pasture-raised eggs good for seniors? Yeah, why wouldn't they be? Pasture-raised eggs are good for juniors. They're good for seniors. They're good for kids. They're good for teenagers. They're good for adults. I mean, unless you're allergic to eggs, right? So if you don't have an egg allergy, there's absolutely nothing wrong with eating eggs. Is there anyone who should not take MSM? Yeah, I mean, some people will react to it, but there's not like a general category, Darla, of people that shouldn't necessarily take MSM. I have parsonage, Turner syndrome. What autoimmune diet should I follow? I mean, I would I wrote No Grain, No Pain for autoimmunity, right? So if you are trying to support yourself over an autoimmune disease, it doesn't matter which autoimmune disease it is. No Grain, No Pain diet is where I would start anyone, because one, the diet absolutely won't hurt you, and two, it absolutely will most likely help you in a very big way. Why would post-menopause woman have one breast grow when, I'm not sure I understand your question. Why would a post-menopausal woman have a breast grow when taking vitamin D3 and K2? you may have a magnesium deficiency. A lot of times in the case of magnesium deficiency, if somebody's taking high doses of DNK, this is a kind of a grouping of people that can sometimes have symptoms associated with taking DNK. Because taking DNK, for the most part, most people are going to be asymptomatic. But again, if you have a big enough or bad enough of a magnesium deficiency, we'll sometimes see problems arise. So you might start with looking at magnesium or asking your doctor to measure your magnesium. I have a cold and sinus infection, sinus pain. What can I try for this type of thing? I mean, well, one, you can visit your doctor, but if you're trying to do some kind of natural things to support it, we have something, Melanie, called Ultra Sinus Support, and it has a number of ingredients. And one of the ingredients in it is NAC, which is, again, NAC is a very, we've done multiple shows on NAC because it's such a powerful thing to do for colds and flus. But I would look at that. I would also look at potentially using a neti pot or a hook bottle that functions like a neti pot, or there's a machine called a Navage, N-A-V-A-G-E, which is like a neti pot, but an automatic neti pot. So any of those things would be potentially helpful for you. Are you planning an update on No Grain, No Pain? I don't know. I mean, the information in it is just as relevant today as it was when I wrote it. I mean, if I were to update it, I mean, it would be nuanced updates. There's nothing majorly, overwhelmingly new. It would require a full-blown update, at least not at this point. I mean, that may change in the future. If you want to kind of get an update of No Grain, No Pain, we do have we have something called the Glutenology Masterclass, which there are a lot of things in that class that go into greater depth and detail than what I was able to do with No Grain, No Pain. Anytime, those of you who've ever wrote a book, anytime you're working with a publisher to write a book, you have caps and limitations on how much information you can put in because there are always kind of size or page number limitations. And so Glutenology was designed to help get more of that information out there. And we'll put a link up to Glutenology for you if you want to check that out. It's free. You can just go, all you have to do is register. It's glutenology.net/register, and it's free. You can watch it. And it's just, you want to dedicate a good solid week because it's over 10 hours long. Histamine issue or intolerance causing ear pressure and headache. Any advice? Are eggs high in histamine? Eggs are not high in histamine tremendously. So advice on if it's a histamine issue that you're having because you have an external allergy. So like if you're allergic to something, because there's two reasons people can develop histamine issues. One would be that you're allergic to something either that you're eating or you're allergic to something you're being exposed to. And so this could be, again, it could be foods, it could be chemicals, but it could also be environmental allergens like ragweed or hay fever or molds. So if you're not filtering your air at home, that might help quite a bit. Now, the other would be, there's a condition called mast cell activation, which is where you're overproducing histamine. And in that situation, there's generally an underlying driver. So again, it's generally something you're being exposed to that's destabilizing your mast cells, causing an excess production of histamine. There's some natural things you can do to stabilize mast cells. We actually have a product called Hist Assist. And it's a mixture of different ingredients that are designed to support the stabilization of mast cells so that they're not hyperreactively releasing histamine all the time. So that's something that might be helpful. In addition, there is also an enzyme that degrades histamine. It's called DAO, diamine oxidase, and you might consider using a diamine oxidase supplement, especially when you're eating foods that either can trigger histamine response or eating foods that have histamine in them. Either of those things would be good. I think don't we have a show on histamine? Yeah, we also did a whole show, Imola, on histamine that we'll put a link up below and you can go watch that as well. Is there a way to lower LDL particle size and number? And that's a can of worms kind of question, Laura, because number one, I would argue, why would one want to lower LDL? Why would one, what would be the premise or the purpose? Okay, and if your premise and purpose is that your belief is that LDL contributes to the development of atherosclerotic plaques and increases your risk of a stroke and heart attack, I'm of the opinion that that is an overblown, overinflated belief. And it's been overblown and overinflated by special interests, and in my opinion, by pharmaceutical companies that stand the most to profit from telling you that. So I would start with the premise of asking questions whether or not it even needs to be lowered. Now, there are cases where, yes, it does, and there are certain types of LDLs or smaller LDL particle sizes that you would kind of want to address. But the biggest risk, small density protein is lipoprotein A, and that's a genetic issue which diet really won't affect. And drugs don't affect it either. Like there's not really a known medical treatment or dietary change that will affect LPA. So there's not much one can really do about LPA. But I would argue on the other side of the equation against what a lot of doctors are saying, about LDL. And if you want to go watch my course on cholesterol, we did a course on cholesterol a while back, and I think that would be helpful for you as well. Now, if you want to lower your cholesterol anyway, what can you do? Niacin is one way to help to do that, as is omega-3 fatty acids, as is diet change. A lot of doctors will tell you that diet change won't affect LDL because the 75% of all your cholesterol is produced by the liver under genetic control, but I would argue that that's absolutely false. I see very frequently people change their diet, and we'll see drops in their cholesterol anywhere from 20 to 50 points, and that includes drops in the LDL particle. So diet can have a big impact on that as well. Are we low on lithium? I don't know. Are you? We test for lithium when we do our micronutrient testing, and some people are low on lithium. As a whole, are all people low in lithium? I would say no. But I do see lithium deficiencies from time to time. Lithium's pretty important mineral that plays a role in immune function. It also plays a role in vitamin B12 utilization, and it's been linked to a number of psychiatric problems. So, you can be low in lithium for sure, but I wouldn't go taking high dose lithium supplementation without having proper testing first. I found out I have celiac 2 years ago. I have not traveled since. My husband really wants to go to Croatia this spring. I'm already having anxiety. What are your suggestions? Plan for the trip. Go. Don't let celiac stop you. I mean, if you're traveling abroad, what I do is I take a food suitcase with me, and that way, if I get to a place and I'm not confident in their ability to feed me, I'll grab from my food suitcase instead. So plan ahead a little planning ahead, can help save you from the anxiety of worrying about gluten cross-contamination. But you'll find places, and you'll find in Croatia, I know you can find some places that you'll be able to get real food, and that isn't full of grain. So I would plan that trip, and just if you know where you're going to go, like call ahead. Contact some of the local establishments, find out a little bit about their menus, get online and look at what their offerings are, and just kind of get an idea. That way, when you're trying to figure out where to travel or where to visit within Croatia, that you're picking places that have food that can accommodate your need as well. Any supplement I can use to detox aluminum? Not so much. I mean, yeah, we have something called Ultra Metal Detox that would probably be very helpful for you, but silicate is something else that can be very helpful. Our water's depleted of that, and so you can use, there are a number of detox products that contain like bamboo silica in them that can be helpful in that regard. Is there a website to find a Hashimoto doctor? I'm so tired of trying to heal as much as I can on my own. I mean, there's a lot of websites, but finding a doctor that matches your philosophy, that knows what they're doing, that can be super helpful, that can be a hard ask. Again, if you're trying to go a functional route, a nutritional route, and not trying to go a traditional medical route where you're just being medicated indefinitely, you just have to keep searching and be diligent. I can't say much more than that. I know that I think it's Isabella Wentz may have a list. You might check her out. We've interviewed her a number of times. She's a pharmacist, a doctor of pharmacy, and she has, I think, a list of doctors in that arena on doctors that actually can help you with your thyroid. How often should vitamin D be tested if taking supplements daily? Depends on the dose that you're taking. If you're taking it like a heavy dose, because the thing about vitamin D is, when I say a heavy dose, that may mean something different than what a lot of other doctors are saying. A lot of doctors will give a patient 1,000 units a day, which is basically like trying to pee out a forest fire. You're not going to do much. 8 to 10,000 units a day is what I would call a therapeutic dose for an adult taking vitamin D. And if you're on that kind of dose, check it at a 6-month interval. You can check it sooner if you want. But 3 to 6 month intervals is pretty acceptable. What do I think about Botox? I'm not a fan of those types of things. I understand why people do them. I'm not judging why people would want to do them, but to me, injecting yourself with a botulism toxin to look younger, it's probably not the smartest thing in the world to do, or the safest thing in the world to do. I would look more toward other natural types of ways to try to stay looking young, like consistent behavior and diet and exercise and sun exposure and sleep. But again, Anna, no judgment if that's something you feel like you need to do, but it's just not something I'm a fan of. I have Crohn's disease and got diagnosed when I was 12. I'm thinking of going on the Lion's diet to eliminate all possible triggers, get a water filter, and improve my lifestyle. What do you recommend? I recommend that, you need to do something. If that's the route you want to go, certainly do it. My recommendation is no grain, no pain as a place to start. But it's also, if you've got Crohn's, get a good microbiome analysis of your gut, because a lot of times Crohn's is triggered by microbial imbalance, and so all the diet change in the world won't alter that to the extent that it may need to be able to help you get to a place where you're comfortable. Let's see here. Eric says, "Hey Doc, love your shirt." Oh, thanks. Yeah, iron sharpens iron. Question: What is for gastritis? Is almond butter okay to eat? So if you have gastritis, is almond butter okay to eat? Yeah, as long as you're not allergic to almonds, or if there's any filler ingredients in the almond butter, should be just fine. Nuts don't really particularly cause a problem. I mean, there can be issues with almonds in that if you have an oxalate issue, high almond intake is high in oxalate as well, and so some people don't do well with high almond. But as a general rule of thumb, if you don't have that issue and you're not allergic to almonds, almond butter would be okay. Is it better to eat bad things very, very seldom instead of never because of the diversity of the microbiome? I'm not a fan of that thought process, Julia. I mean, I think first define what you mean by bad things. I think we may have, I don't know what your definition of bad things are, but if you're saying if a bad thing to you is like Coca-Cola and candy bars and synthetic sweeteners, to me, those are just things that I'm not going to put in my body ever. They're not going to enhance the diversity of the microbiome. Let's see. Sally Norton said kale is low oxalate. There's so much discrepancy in the info online. What is low or high oxalate? How do I know which list is accurate? Well, I can't speak for all the lists that you've looked at, but there is a type of kale that's low in oxalate. It's called lactinato kale. But that specific type is low in oxalate. The others are not. What do you think about ashwagandha, magnesium L-threonate, and 5-HTP, or hypnosis for mental health? I think those are all fine. They're none of them. I mean, unless you're specifically deficient in magnesium or specifically deficient in tryptophan, that taking those things to deal with mental health issues is not going to be your solution. Same thing with ashwagandha. They can all be helpful, but especially for stress, but not necessarily creating a solution. I think if you have a mental health issue, you really want to ask the question, why do you have a mental health issue? Is it because there's things you've gone through traumatically that you need to deal with or cope with? Is it because you work in an environment or a job that you don't like and it's really weighing down on you? Is it because you're overly stressed because you're sick all the time? I mean, there are a lot of different potential reasons why someone's mental health would go south. Those supplements can be supportive, but if they're not the reason that you have a mental health issue, you have to address the reason. So dive deeper and ask that deeper question. Got my uric acid tested and it was high. What can I do to lower it? The biggest thing lowering uric acid is a clean, whole food, real food diet. You can do things too, like cherries. There are a number of supplements designed to help support the lowering of uric acid. But at the end of the day, uric acid's elevated typically over behavior, dietary behavior, and what you're actually eating. Thoughts on low gluten beer or hard seltzer? Low gluten beer, if you're gluten sensitive, is not no gluten beer, so I don't recommend it. Hard seltzer, a lot of them you got to watch out for because of the other chemicals and additives they can put in them. One of the ingredients that commonly they slip in hard seltzer is malt. Malt is a sugar derived from barley, so it's not going to be gluten-free. And then you also just have the fact that all of it is alcohol, and if you're sick and you're trying to restore your health or recover, alcohol is not going to help you do that. So as a general rule of thumb, if somebody is trying to restore their health from illness, I don't recommend any kind of alcohol. What kind of test would show what kind of meds are better for a specific person for mental health? Ask your doctor to run. There are different genetic SNP tests. There are different genetic panels that can be done to help your doctor understand how you metabolize certain medications better or worse. And if your doctor doesn't know what those tests are, you need to find a new one. Any tips on how to heal faster from herniated disc? Is copper good, and what is the max dose I should take? I mean, copper's fine. May or may not help your disc heal if you're not deficient in copper. Taking high doses of it may not be the solution per se. With a herniated disc, it's you can take things like vitamin C and copper and zinc, which are all necessary to help heal and form the disc. You could also use and make sure you're getting enough protein. Approximately in terms of protein, about 1.5 to 2 grams of protein per kilogram of body weight. The light therapy that I use for athletic recovery is called a platinum LED. That's the one I like. It's the one I use personally. Elizabeth. Which iron supplement is best to raise hemoglobin fast? Ultra iron. We put a link up to ultra iron for Marzina. Doesn't vitamin C turn into oxalic acid? It can. It can. So, some people with super high oxalate or oxalate issues don't do well taking high doses of vitamin C. So that is a potential issue that, needs to be assessed if you're considering high doses of vitamin C. Karen says, I've been using castor oil wraps. What a blessing those are. I've been wondering how long can I do these wraps? There's not a time limit. I mean, there's no real great known contraindication for using it topically. I mean, unless it's just irritating your skin. But if you're tolerating it well, there's not a time frame. I don't understand this question. My mom's in the hospital. Taco is suspected. Is that a typo? Angela, maybe give me a little bit more clarity on what you mean. I bruise easily. What could be the cause of that? A lot of things. Vitamin C, copper, iron deficiency, vitamin K deficiency. There's a couple dozen nutrients that could be contributing to that. If you're on certain medications that thin your blood, that certainly will make you bruise more readily. Protein deficiency can increase your bruising. The best thing to do, Layla, if you're thinking what nutritionally might play a role in bruising easy, it would be to get your micronutrient status checked, and then you'd have kind of more definitive of an answer. When using intestinal defense, do I use 3 pills a day until the bottle is gone? If you're trying to do a parasite cleanse, like an actual just kind of a cleanse, you'd actually use 4 a day. If you're just trying to be preventative with it, during the full moon, you just take 2 a day during the week of the full moon. I took Accutane a few years ago and still feel changed from it. From my understanding, in rats, high-dose Accutane actually mimicked vitamin A deficiency, and they had nyctalopia. So, yeah, if you're still struggling from the use of Accutane, I definitely encourage you to get some milk thistle or a product that has milk thistle in it, because one of the issues with Accutane is liver damage. And if you're not quite right, you can use milk thistle to support liver function. It's a very powerful herb for the liver. Is there a natural treatment for scabies? If not, what is the best treatment and prescription medication? Resistant to prescription meds. What can you add together that might work? I've never seen that, Lita. That's one I've never really dealt with naturally, is scabies. So I probably am not the best doc to answer that question. I have CKD. I would assume you mean chronic kidney disease. I'm always losing all of my potassium. I cannot drink water because it makes my blood pressure go high. I can only drink orange juice. I would say it's the type of water you're drinking. If your water's going high, or if your water's taking your blood pressure high, I don't know if you're drinking reverse osmosis water, but that can actually contribute to a worsening in CKD. So I would say if you're using water, you want to put an electrolyte blend in it. The reason you can probably drink orange juice is because of its potassium content and other mineral content, but orange juice is not going to help you recover your kidneys because of the sugar. So you're just hammering your kidneys already in decline, and you're hammering them with an overaggressive amount of sugar to stay hydrated. So talk to your doctor about, using electrolyte more aggressively. Recent nutrient deficiency shows a bunch of vitamins and trace mineral insufficiency. Should I take individually or just take multivitamins and multi-trace mineral? Depends on what they are, Hamid. Possibly that, but also possibly taking certain ones individually, because Sometimes you have to, when you're low, using a kind of more of a therapeutic dose to overcome can be very effective and very helpful. Let's see here. Cancer and osteoporosis, best supplements. Well, for osteoporosis, Kathy, I would recommend using our bone box. It's a blend of minerals and vitamins that help to support bone growth. As far as cancer, depends on the type of cancer, depends on if you're getting other types of cancer treatments, if you're getting any kind of chemo or radiation. There's a lot of variability in that, so hard to give you an exact answer. If you're past cancer and you're in remission, and you're just trying to say, what can I use to help kind of try to prevent cancer from occurring in the future? There are a lot of good supplements that you can use. But again, it's just hard. It's a tough answer because what kind of cancer is it? Where is it? How long have you had it? What kind of treatments have you had? What kind of treatments are you currently having? There's just a lot of variability in that question that I can't give you just a generic answer to answer it. Best way to get calcium, food. Irene, I would encourage you to watch our crash course on calcium to learn more about it. But food is the best way. You can get it through supplementation as well, certainly, if your diet is restricted in some way and you're not getting enough through your diet. But food-based calcium is one of the best ways to get it. Hi, doctor. After COVID vaccine, rheumatoid arthritis severity has increased, severe inflammation in wrist and ankle joint. What can I do? I've seen a number of cases over the past year and a half of COVID-induced or vaccine-induced rheumatoid arthritis. And there are actually now studies being published on the WHO website. The world, I know a lot of you are like, who cares about the WHO? But there's a reason why I have to say that, so I'm going to say it. The WHO has actually published multiple studies on post-vaccination rheumatoid arthritis causation with COVID shots. So this is one of the big travesties, of the past few years. And when I was sitting back watching rheumatologists say how safe it was for people to get those, and then now a lot of people are developing that issue as a result of them. So the best thing I've seen, Neha, is the no grain, no pain diet. Can be very, very effective. There's actually some evidence now, and I wrote an article about this, how either COVID or the spike protein itself can actually contribute to the development of gluten sensitivity in celiac disease. And there are some researchers that are predicting a massive rise in gluten sensitivity as a result of COVID and the treatments for it. Maybe we can post that article up for Neha as well, but I would start with no grain, no pain. My boyfriend said celiac disease is rare. He's wrong. It's not rare at all. It's at least in 1% of the population, which isn't rare. 1% is not rare. But gluten sensitivity is estimated to be as common as 6 to 13% of the population. And so, whether you're talking about celiac disease or non-celiac gluten sensitivity, it is definitely not rare. If nutritional hair loss is the case, can it be reversed with staying away from gluten? In some cases, I've seen cases of alopecia areata where people had massive patches of complete hair loss on the scalp, and it grows back with a gluten-free diet. I've seen that happen. That being said, there's a lot of factors involved with hair loss. It's not, I would say not just the gluten-free diet. There are a lot of other things to consider. And I would encourage you to watch our show on hair loss if you haven't already. We can put a link up to that show for you in the comment section. What do I think about Irish Seamos? Not much. It's not something I use in my practice, so I don't have a whole lot to say about it, good or bad. What kind of testing do you recommend that give you the most bang for your buck when it comes to health and causes of things going on with you? that's a tough question, because the most bang for your buck, if I told you to get tested for gluten sensitivity and you weren't gluten sensitive, then that test wouldn't be giving you the most bang for your buck. If I told you to get micronutrient levels tested and you didn't have a lot of nutritional deficiency, then that test wouldn't be the best bang for your buck. If I told you to get food sensitivity tested for other foods beyond gluten and you didn't have a lot of food reactions, then that test wouldn't be the best bang for your buck. And if I told you to just do one of those things, but you had problems in all of those areas, then you would be missing, you'd have gaping holes in your analysis, and so you might not feel better doing just one of those things. And this is why, I have a term for this called piecemealing. It's when people piecemeal data and try something for a little while, and if that doesn't work, they kind of move to the next thing. The body's comprehensive, and you have to look at it from the overarching 10,000-foot view, and you can't just selectively say, I'm going to do this for a while, or I'm going to do that for a while, or I'm only going to test this thing, or I'm only going to test that thing. So I know that's not the answer maybe that you wanted to hear, but I think it's the honest answer. And so if you're trying to budget, which tests to do, what I would suggest that you do is don't spend money on a test until you really can get a full comprehensive picture. And there are 4 categories of testing that I like to encourage people to ask their doctor to do. One is measuring your reactions to foods, including gluten. One is measuring your reactions to chemicals or chemical exposures. Another is measuring your microbiome status. And then the fourth is measuring your micronutrient status, your vitamins and minerals. And looking at all of those things simultaneously, in my opinion, is the best bang for your buck. So if you're looking to say, okay, if you're trying to pigeonhole me into giving you an answer, it's look at all 4 of those categories. And so again, if you're trying to budget that, then get costs for all 4 of those categories and then budget to do them all at the same time, because when you approach it simultaneously, the outcomes are phenomenally much better than if you try to approach one thing at a time. 80% of the people that come to me in my practice have been piecemealed by multiple doctors, and this is why they're coming to me, is because the piecemealing effect or approach didn't work for them. So this is just, again, my own experience is to not piecemeal and to be honest about that. Because personally, if somebody comes to me, I would rather take none of their money than take some of their money and have mediocre results. I'd rather say, look, if you want to budget for this, budget for it, and let's have meaningful outcomes. But if you're asking me to piecemeal, that's just not something that I encourage anyone to do, especially when there's a significant financial commitment that you're going to make around it. Are there ways to reverse large granular lymphocytic leukemia on a low-carb diet? I've seen some people with leukemia do really well on grain-free diets, not necessarily low carb, but grain-free. There's actually some evidence on gluten sensitivity creating an increased risk for leukemias, and so that would be one of the things that I would encourage you to look up and research more, Dawn. Is there a place I can order to make multivitamins and trace minerals based on my nutrient insufficiency test? Yeah, Gluten-Free Society, if you want to go there and you're looking to access, we have over 100 formulas at Gluten-Free Society for nutrition. And so if you're looking to take certain nutrients, multivitamin, etc., we have those things there. Thoughts on colostrum? I think colostrum can be very helpful for some people. I think some people also react to it. I've seen quite a few people react to it when they are also reactive to dairy as a whole. So I'd say if you have a known dairy allergy or dairy sensitivity, then colostrum would not be probably the best choice. There is a bovine alternative to colostrum. It's called Immune Shield. And so if you are looking for a dairy alternative, that would be something I would recommend. But I'm a fan of colostrum. I think it can do great things for folks. What do you like to see vitamin D levels at for an adult 65 years old living in the northern states? I was taking vitamin D 8,000 IU daily. My blood level was 109. Perfect, 109. I mean, that some doctors would freak out and freak you out and say you're toxic, but the amount of medical literature that reports vitamin D toxicity is almost 0%. Not quite zero, but there's very little on vitamin D toxicity ever actually occurring at 8,000 units a day. Now, if you're at 109, do you need to continue taking 8,000 units a day? No. If you probably want to keep your D somewhere between 70 and 100 in the northern states, especially in the winter months, because vitamin D is an immunoregulator, so it can help your immune system function properly. And you could probably come down to about 4,000 to 5,000 units a day, and your level would probably drop at that during the winter, and it would probably come back, somewhere between 70 and 100, 3 months from now, 4 months from now, if you rechecked it. But that would be, a simple thing to do. Are you a fan of activated charcoal? For certain things, I am. What nutrient test do you recommend for osteopenia? So if you're trying to get a full-on assessment of your nutritional status, I recommend the INA, the intracellular nutrient analysis test. We can put a link up to that for you, CP, if you'd like. Thoughts on blue-green algae for lowering triglycerides, raising HDL, and lowering blood sugar levels? I wouldn't say that blue-green algae is a miracle for doing those things. If allergic to all the grains and react potatoes, what about sweet potatoes and bulgur wheat? Well, if you're allergic to all grains, then obviously you wouldn't have bulgur wheat because that's a form of grain. But as far as sweet potatoes, if you're reactive to regular white potato, then sweet potato could be an alternative for you. You mentioned that long-term use of antihistamines can cause dementia. Would regular use of the sauna offset that? No, because the reason that long-term use of antihistamines contributes to dementia is because it inhibits the action of histamine, and histamine is a neuroactive peptide or chemical that helps your brain think and function. And when you're blocking that, that's where you're going to get into trouble. Antihistamines can also reduce stomach acid, causing malabsorption of nutrients that are important for brain health, nutrients like B12 and magnesium. So taking a sauna is not going to reverse those side effects of antihistamines. What kind of doctor will test for problems with MTHFR? I have 2 autistic sons and we all have similar physical issues. What exactly is the test for this? It's a genetic SNP test. In kids it can be like a blood spot, like a simple finger prick. Or even in some cases a cheek swab, depending on the lab, depending on the doctor. As far as if you have 2 autistic sons, I would find a functional pediatrician, and most good functional pediatricians will be looking at MTHFR gene mutations in their autistic patients. Can elastase be completely healed? You mean an elastase deficiency? So elastase is an enzyme produced by the pancreas, and some people have elastase deficiency, or they have what's known as pancreatic insufficiency. So the pancreas isn't properly producing adequate quantities of elastase. Can that be healed? It can be. A lot of times that pancreatic insufficiency is contributed to by gluten exposure. Gluten can damage the pancreas. So I've seen a number of cases where people had, a pre-existing case of elastase deficit, going grain-free, going gluten-free, having correction of that problem over time. Can I do anything to reverse chronic kidney disease? Yes. Check out our show on kidney disease. There's a lot that you can do. I got your Gluten Shield supplement. Should I use it only when eating gluten, or should I use it every day regardless of gluten intake? Either or. So, one way to use it is so let me rephrase that. You shouldn't eat gluten if you're gluten sensitive, and all the Gluten Shield in the world is not going to protect you from gluten bombing yourself. So I just want to be clear that this is not a supplement designed to allow you to go eat Subway or a pizza. What it's designed to do is help reduce the potential risk of damage caused as a result of you getting cross-contamination if you're eating out or traveling, or you're not controlling your food and you're not 100% sure that it's gluten-free, or there may be somebody in the restaurant made a mistake as they were delivering your food to you and they accidentally got gluten in your food. So don't take Gluten Shield as a stop-all. There's not a gluten-degrading enzyme product on the market, including Gluten Shield, that is designed for you to purposefully eat gluten. So hopefully that helps answer your question. What do you recommend for arthritic pain in my hands or my thumbs? There could be a lot of different things, Joyce, that might be helpful. Because of the time constraint that we have today, I'm already 20 minutes over here. I would encourage you, we did a natural remedy show on arthritis, on pain. And so there's a video with a lot of different really great suggestions. And so we'll put a link up for you below and you can go check that video out. I just recently developed scurvy from a low-carb, gluten-free diet. I just ordered your vitamins for the first time, hoping for good results. Yeah. I would say gluten-free diet is not something that would generally tend to cause scurvy, but the low-carb aspect of it, especially if you cut out, all vegetables and fruits, which is where the vast majority of vitamin C in the human diet is. But Anzu, let us know how it works for you. Come back. Once you get it, come back and talk to us about how it worked for you. Okay, so when you have to take vitamin C supplement in case fruits are not available, which one would you recommend? Well, I recommend, we have two different kinds. We have Ultra C and we have something called Detox C, and either one of those would be premium forms of vitamin C. Hello from New Zealand. Interested in your thoughts on taking a creatine supplement. I like creatine. Creatine. Where people get in trouble with creatine is they take a product that contains all this other garbage in it. So it's like creatine plus a bunch of other garbage. But pure creatine monohydrate, fantastic. It's it's a very, very effective supplement. Whether you're trying to weight train and just increase your muscle mass. And you could be, 80 years old and a woman trying to increase your muscle and bone mass through exercise. Creatine is going to be very beneficial and helpful. It's very safe to take, very little complication or very little contraindication, and it can be extremely effective. It's probably one of the few in the industry of fitness that of supplements that are commonly touted that actually works extremely well. How do I feel about sprouted grains like Ezekiel bread? They got gluten in them, so if you're gluten sensitive, I don't recommend them. Again, it boils back down, Jessica, to whether or not you have a gluten problem. If you don't have a gluten problem and you're using like an organic Ezekiel sprouted bread and you don't have a problem with gluten, more power to you. But if you are gluten sensitive, Ezekiel bread is not gluten free. Let's see. Thoughts on nattokinase, thoughts on diatomaceous earth. I like them for different reasons. It's just, there's a, when you ask me what are my thoughts, I have a lot of thoughts. And what I would just encourage you to do is if you have a particular question about it, ask the question, because I can ramble on about thoughts all day long. How do you test for environmental chemicals and reactions? We use different blood and urine tests to measure the exposures and to measure the immune responses to those things, Lita. My doctor cringes every time I bring up leaky gut. Well, you need to find a new doctor. I mean, if your doctor cringes at the thought of something that they don't understand that's been medically validated and scientifically demonstrated to be true, why are you seeing them? This goes back to what I was talking about earlier, which is you have a choice. And if your doctor isn't willing to listen, isn't willing to be helpful, isn't willing to be inquisitive, then why are you paying them money to waste your time? Don't do that. The ball's in your court. You have the option. What do you think about LDN for Hashimoto's? I think if you're having to take LDN for Hashimoto's, you're missing something. I'm not opposed to LDN. A lot of people find it very beneficial or helpful, but at the end of the day, look, you shouldn't need low-dose naltrexone in order to feel good. Your body shouldn't need that drug in order to feel good. And if you're still not feeling well and you're using LDN to help you improve your quality of life, you're missing something and you need to ask or get with your doctor to try to dig deeper. Can I take colostrum when I'm allergic to milk? I don't recommend it. If you're allergic to milk, colostrum's not something I recommend. Let's go down on the left. What's the maximum amount of ultrabutyrate per day? I really wouldn't go over 2 to 3 capsules. The 2 to 3 capsule range is pretty therapeutic. How do you diagnose fibromyalgia? Very subjectively. Fibromyalgia is one of the most subjective diagnoses in the medical realm of diagnoses, and so there's a list of super subjective criteria that a doctor looks for, tender points in different areas bilaterally on the body, and a number of other vague and sundry problems like chronic fatigue, etc., that are used to make that diagnosis. There's not a definitive laboratory objective evaluation that doctors use to diagnose fibromyalgia. But my experience in people that have a fibromyalgia diagnosis is that typically they're in mold, and they're being exposed to mold, and they're being damaged by it, and it causes mitochondrial damage that basically it disrupts the nervous system and disrupts their perception of how they interpret pain. And because it disrupts their mitochondria, it causes a lot of chronic fatigue. Okay, I think I'm going to go eat lunch. I just got too many questions to get through today. Those of you, if I didn't get to your question, come back next week. We do this Thursday, every Thursday at 12:30. And anyway, I hope today was helpful for you. I hope today you gathered and garnered some new information that might help you, be healthy and stay healthy. Don't forget about our mission. Our mission is to help save 100 million lives. Hashtag save 100 million lives. So use that hashtag. Share this video with someone who you love, who you think needs it, who you think needs to hear these messages about nutrition and health. And that's how you can support us. Look, share the information. Together, we can help more people. And just want to say thank you to all of you. We hit 200,000 subscribers this past week on our YouTube channel. The censorship officially, hopefully I'm not jinxing myself by saying this, but the censorship has been let up, and we're now actually growing at a pretty quick pace. So we're on pace to reach that 100 million, and we only can do it when you share the information, and that's how you can support us. Now, if you want to support us in other ways, if you're looking to get supplements, or you're looking to do some lab tests to help you identify what nutrient deficiencies you have, or looking to identify what foods not to eat and whether you're gluten sensitive, come visit me at glutenfreesociety.org. We have all of that available there to you, and of course we appreciate all of the support that you guys send in, whether you're purchasing our products or whether you're just here every Tuesday and Thursday to support us in our viewership. So thanks so much. We'll see you next week.